We now have a little bit more of insight into maternity care during pregnancy and oral health, but what about when we move into the childhood space? What can we do there? I told you she'd be back, and she is. I want to give some more chance to set the stage here to Brittnay, our oral health clinical portfolio manager. Brittnay, are you game to take us through doing an intro here?
Yep.
All right, it's all yours, my friend.
Thank you. Yes, I appreciate the opportunity to be here and plug in little bits and pieces again what we do here at CareOregon and how we are supporting our network and integration. So moving into children's oral health, I do appreciate what something that Chelsea mentioned, that emphasis on productivity in healthcare. And so that's pretty universal across all healthcare. So when looking at oral health integration, what can we do as a health plan to really build out those programs and that infrastructure to support our network so they ultimately can support our members? So the journey here, just a quick snapshot of 2017 before my time here through 2023, all of the amazing work that we do here. Definitely started with launching that cross-regional initiative for kiddos, just like we have for maternal oral health. And so it really started with thinking about the roles and what we would need here to support this work. And that's when the dental hygienist role here at CareOregon was implemented. So if anyone's familiar with First Tooth, I am also an expanded practice dental hygienist who provides First Tooth training for a lot of our medical partners in our networks. And then again, just developing those resources and tools, providing that technical assistance and support. I showed some of our resources like our brochures and our toolkits. We have them for our maternity populations, our children, and chronic condition populations. So definitely have our priority populations here that we definitely like to focus on, especially for oral health. So we talked about oral health during pregnancy and how it's twofold, an upstream approach, looking at downstream for the kiddos and the family in the future. And thinking about oral health, oral diseases can negatively impact the body in many ways. It can be associated with poor outcomes among people with various other health conditions. And so I think Amit mentioned quite a bit about diabetes control and oral health and how those really have a bidirectional relationship. But just thinking about your own health, I know personally growing up, I did not have dental insurance. We didn't have any health insurance. It was really, you get a cavity, you get it fixed. My father is, the healthcare practices in our home where teeth are something you have, cavities are something that you get treatment for it, and teeth are something that you lose and you get dentures. So we definitely want to refrain from that ideology, remove that, and move forward with prevention, right? So let's keep our teeth throughout our lifetime if possible, or get people healthy where they are. Chelsea touched on that quite a bit, and that's something that I like to say too, is where are these members at in their overall whole health, and where can we meet them with that, and how can we support them? However, in thinking about health conditions, oral diseases are frequently considered separate from other health conditions. So you may remember when I first came on discussing how we wanted to get oral health on the map, just get everybody kind of talking about it, get an awareness, dental benefits, navigation, education, all those amazing things. So what can we do to help from a health plan perspective, help our networks with that? So untreated tooth decay can, result in persistent dental pain for kiddos, infections, inability to chew, eat, drink, speak. So all these formative things throughout the years. Teeth are little placeholders for our adult teeth. So we want to keep those intact and keep those healthy. It can affect a lot of things for kiddos. So we want to set them up for success before they even get their first tooth. And so how can we promote oral health in these other spaces? And so that might include oral hygiene, discussing dietary habits, and then reinforcing the need for routine visits and receiving fluoride varnish. So we'll get into a little bit about that here in a bit. primary care is really seen as kind of a main point of entry for people. So that's where they come in for their well child visits more frequently and before they have their teeth. So it really represents a remarkable opportunity to help meet those oral needs. It also is another access point for kiddos and families. And so again, just reinforcing that messaging, that importance, and also providing services that are allowed under medical can be huge. So promoting preventive practices, really emphasizing that importance again on those dental checkups. In alignment with the United States Preventive Task Force back in 2014. So I don't like to throw dates around. This work has really been going on for over 2 decades, though, seeing how we can best model how to approach oral health integration in primary care. But the recommendation is that primary care clinicians apply fluoride varnish to the teeth of all infants, starting with the appearance of the first tooth. And then the recommendations by the American Academy of Pediatrics for preventive health practices. So thinking about that whole person healthcare and all prevention care, right? Oral health should be included in that. So definitely in those very early formative years. So 6 months through to 6 years is very important to establish those routines, receive those services, establish that dental home. And it's beneficial for kiddos to have multiple applications of fluoride. So wherever they're kind of being seen, again, where they might be at, and that might be primary care, let's see what we can provide. And again, it might sound like it's a lot, but again, that's why we're here with all of our resources, technical assistance and support to help with implementation and make this as streamlined as possible. So why do we do this? As if there are primary care providers on the call here, you may have seen young kiddos with the start of dental decay. And so we really want to prevent this. And we really try to look at Oregon specifically. And in 2017, the SMILE survey showed that about 50% of kiddos age 6 to 9 had experienced caries. So they either currently had a cavity or had some form of treatment. So we really want to reduce that. And unfortunately, due to the public health emergency, we don't have more recent data, but they are gathering that this year, hoping to have some in the near future. I anticipate it will be potentially a little higher than previous years, just as care has been delayed over the public health emergency and is still going on currently. But early childhood caries is up to 8 times more common than asthma. And thinking back to when Amit was talking about social determinants of health and throughout life, and having dental decay and disease throughout childhood and going into adulthood. Also during pregnancy, sharing the bacteria with our babies, and the whole process just kind of comes full circle if we don't start implementing the education and that preventive, really reinforcing that preventive. And so we want to reduce the pain, the tooth loss for kiddos and individuals throughout childhood. And like I mentioned, even just thinking about the speech and nutrition and you know, for kiddos, it can still be, we might not think of it as much like we do for adults, but it can still cause significant impacts to self-esteem. So I got to see that quite a bit throughout my work before coming to CareOregon, working with children. The dental decay on the upper front teeth, kiddos might be ashamed or be teased, might not want to speak, or they may not be able to open their mouth just due to the air even causing pain. So let's reduce that for the kiddos. That's definitely been my mission for quite some time. So I mentioned during my pregnancy, the oral health and pregnancy presentation, that we have lots and lots of resources and materials. So again, for pediatrics, we definitely provide training, technical assistance, support. We have provider and member brochures. We've touched on the dental care request that we have at CareOregon, helping with that dental navigation. I'll touch on that a little bit later on some things that we're building out to support even further on closing the loop for dental referrals. So that's one of the biggest accomplishments I'd say we've had here at CareOregon. And then lastly, of course, we have an oral health integration toolkit for pediatrics. This is really extensive, even more than the maternity one, given that there are quite a few oral health services that can be provided in primary care. So there's a lot about Oregon administrative rules, what can be billed. Again, having those implementation checklists, having those screening examples, information on our dental care requests and workflows, technical assistance, lots of resources to research and information on fluoride varnish and other services in primary care. So this one is really extensive. It's really another one of our pieces that we have much pride in. And again, this really helps our network by having everything in one concise location that can be shared amongst their organizations and really covers everything extensively. For the services that can be provided in primary care, I figured I'd just tee up a little bit on what will be discussed by Adventist. So they really are some of our oral health champions within our regions, providing oral health services for their patients and have been doing so since I believe 2017. Conversations might have started in 2016. But the services that can be provided in primary care, of course, we've been talking about referrals, we've been talking about education, and then the importance of that screening or assessment. But it's really unique in that fluoride varnish is another service that is really important and only applicable to pediatrics specifically. So that's kind of the component that is important to navigate and implement in primary care. And so I will let Adventist share how they've implemented all of these wonderful services for their patients, how it's been going in future state.
Brittnay, thank you. Wow, you are just all over the place here today. This is fantastic.